Welcome to the Afghanistan Spatial Data Center. In this segment, I will be giving general information needed for the certification process. My name is Dr. Emlyn Hagen, and I am the iMMAP Disaster Risk Reduction Program Lead. The DRR program is a USAID-funded project in which the ASDC is the data dissemination segment. The following information is basic background information, which you will also be able to find in our online documentation. It is especially useful if you want to become an ASDC certified professional user. The certification process is a project which we just launched to enable users to show within their own organization that they are certified to use the ASDC in a professional manner and that they know most of the functionalities and that they have the skill set to expand this knowledge by themselves. Let's go to the interactive maps. Here, a range of our base products are loaded. And first of all, let's go to the travel time from facilities and locations. Let's zoom in a bit. And currently, the travel time to the nearest hospital H1, H2, H3 is loaded. Now, what does this mean? Well, the health facilities Tier 1 hospitals refer to regional and national hospitals, H1, provincial hospital, H2, and district hospital, H3. Then we have our Tier 2 health facilities, which include comprehensive health centers. The Tier 3 health facilities include basic health centers, BHCs, and sub-health centers, SHC. Knowing the difference between them is actually quite important. Tier 1 hospitals offer the most advanced type of medical services, whereas Tier 2 offer more advanced services than Tier 3. And then we also have other health facilities. And these include all health facilities which were not categorized in any of the Tier 1, Tier 2, or Tier 3 types. Some of these health facilities, of these others, can be private medical facilities, which might be much larger or quite advanced, almost at the level of, let's say, a provincial hospital, but are simply not listed as such. The difference between health facilities is especially important when we look at accessibility. The travel time to the nearest Tier 1, so the provincial, national, or district hospital, is very much different for this region than for the Tier 2 hospitals. You can see there's a lot more green. Now, it is crucial to understand that when I look at this layer and the accessibility to the nearest hospital, Tier 2, that this will also include the H1, H2, and H3 categories. The reason for this is simple. If I live only 5 minutes away from a provincial hospital that offers me advanced medical services, but the nearest comprehensive health center is, let's say, an hour travel time away, I will naturally go to the provincial hospital. Naturally, the basic or sub-health centers will not be included here, as these do not offer the same type of service as a comprehensive or Tier 2 medical facility. The accessibility data can also be found using the Settlement Inspector under the Accessibility tab. And here, as mentioned in one of the previous videos, you can also see the GSM coverage for this specific village. Here you can see that its provincial capital and its nearest provincial capital are not the same. Most of the time, these will be identical. The closest provincial capital refers to the capital which is nearest in travel time and in distance, whereas its provincial capital refers to its administrative capital, which is in this case 248 kilometers away, where the nearest provincial capital is only 192 kilometers away. We have similar information for districts. If we click here, we can go to the district centers, and we can see that the provincial capital and the nearest and its provincial capital are also different, but the closest district capital is also different than, in this case it's the same. Let's go to a different district center. Let's try it again here. And we can see that here its district capital is 50 kilometers away, whereas the closest or nearest district capital is only 35 kilometers away. This information might be useful in a time of emergency response. The nearest capital or district center might be more beneficial from a logistical perspective, but to request governmental support or aid or financial support, probably it needs to go through its official administrative district center or provincial capital. Now, it's incredibly important to note that the travel time and distances are modeled data. These are not absolutely accurate, and they can be wide variations in this. This information will improve over time, but it's not perfect. Let's go to the avalanche map. Avalanche forecast map. We're in the middle of summer, so there will not be any avalanche forecasts. But it's quite important to understand that the avalanche areas themselves are modeled together with the population data. They're ballpark estimates. Let's open up the statistics tool and let's calculate some statistics. Here we can see that the total population of entire Afghanistan is 31 million. For large areas such as Afghanistan or a province, these numbers will be accurate. However, it must be noted that these are not governmental endorsed numbers. These are modeled numbers. For a specific village or for a small group of villages, the numbers can be highly inaccurate. For that reason, if you are interested into the estimates within, let's say, a very tiny area, and we apply the statistics, it's advisable, there's apparently 106 people living there, to zoom in very closely. And I actually doubt that there's anybody living here because we're in very mountainous regions, and open up the satellite imagery in the background. And then assess. Let's zoom in even further. It could be that there's a few people living in here, but definitely not 106 persons. At least that's what I doubt. Let's press reset. And we can see that in this valley there might be some agricultural activities as there are some roads, but our population numbers are likely inflated. It could be that within this region there will be, perhaps it's a few hundred houses, there might be a few hundred people. This was just an example to show that our population data is modeled. It is based on a scientific methodology, based on topography, locations of rivers, land cover types, and it is created to help with risk assessments for flooding and avalanches. Again, also these numbers will improve over time. When we talk about avalanches, let's switch off back to no background. Let's talk about avalanches. We have avalanche forecast information. I did not select any area. Let's calculate again for entire Afghanistan. Here you can see when the latest avalanche forecasts have been calculated, and very often these will be exactly the same numbers, when the latest snow coverage and snow depth was estimated. This should be generally not more than 24 hours before you reach this website. It's the same for the flood forecast. At the bottom of the flood forecast within the statistics tool, you can see when the flash floods were last updated, should be generally between less than 1 hour ago, and the river floods should be updated approximately every 6 hours. Should these numbers be more than a few 1 day old, please contact us, because that means you are not receiving the latest information. Very shortly, with the settlement inspector, we can look at the snow cover for this specific village over the year. And this is useful for planning purposes, winterization planning purposes, or when I need to construct any type of infrastructure. We generally do not do this when there's actual snow on the ground. And for our last point, let's go quickly to the interactive earthquake map. I'll load the latest earthquake. You can see it actually here. This map is the latest earthquake. And let's load the earthquake event of 26th of October last year. This map shows you the shake intensity at the surface. Generally, a higher shake intensity results in more damage. Now, this is model data. This information is intended to help you prioritize your response efforts. But it must be noted that this information, that there's different construction methods over the country and different soil conditions. Yellow, red, orange will normally translate into more damage, but naturally, the actual reports from the ground will reflect real damage. This is only just after the earthquake, a tool that can help you prioritize your response efforts. The tool does not tell you where there have actually been more houses destroyed. It shows you the likelihood that more houses have been destroyed, but that again depends on a variety of factors. I hope this information was useful, and it should be able to help you to answer the questions for this ASDC Professional User Certificate, but naturally you also need to find out the other videos or read the online documentation. If you have any questions, just write us an email.